Hello, folks. Welcome. This is the Eye and Ear Foundation's Sight and Sound Bites, brought to you bi-weekly from the Eye and Ear Foundation. We're going to have an opportunity to talk a little bit about something that we're really proud of that we're doing here in the community. Our bi-weekly seminar is brought to you to share with you the work that we have going on in the Eye and Ear Foundation to support research for the departments of ophthalmology and otolaryngology at the University of Pittsburgh, as well as the care in the community that both of the departments do, which we're going to hear a little bit more about today. Today's topic is behind the scenes, the impact of providing care at the Mission of Mercy, which is an event you're going to hear about that both of the departments of ophthalmology and otolaryngology were part of this year. Very proud to introduce my friend Keith Young. Keith Young is the Pittsburgh chairman of the Mission of Mercy, the organization Call to Care here in Pittsburgh. And I'll be introducing Keith after I kind of first go over a few things with you about what the Eye and Ear Foundation has been doing as it relates to some of the work and care in the community. First, just a few housekeeping rules. As we know, as for those of you who joined us before, our webinar series is on Zoom, and it's in the webinar function of Zoom. So you can't chat with each other, but you certainly can ask questions. We encourage you to ask questions. If you could please put them in at any time during the program, we'll get to those at the end. Okay, with all that aside, I'm going to get started here. So even though, as I mentioned, our focus for the most part has been trying to advance care, we really are trying to make care better for every individual that loses hearing, vision, or we work on many things with head and neck cancer and other conditions that, again, we want to improve for quality of life. So we also realize that the same level of care is not available to everybody. And that is why so much of the work that we support through the Eye and Ear Foundation also exists in the community. And there are two main areas that this happens in with each department. In the Department of Ophthalmology, we work with the Gorilla Eye Service, and we've been supporting that for years, even before my start 13 years ago at the foundation. Dr. Jake Waxman runs that program, and it's a wonderful program that uses residents and volunteers and going directly into the community. We also support what Dr. Catherine Palmer does in the community under her program called Hear Up. And then just as a few years ago, we teamed up with a Call to Care and the Mission of Mercy, which you're going to hear about today. So the Gorilla Eye Service was founded in 2006 by Dr. Jake Waxman and as a mobile eye clinic to provide free vision screening to underserved populations in Pittsburgh. What he would do is he'd bring faculty, residents, medical students, and they would pack up a van and they would go every month to a different federally qualified health center, where they make, in that center, they bring out all their equipment and they really make an eye lane so that they can do full care, vision screening and care for patients for every condition that they may encounter. And then patients then end up getting referred back if they have larger problems. They receive eyeglasses there, or they'll get referred to the institution if they need any other further follow-up. But Dr. Waxman approached me, and this is one of the things I worked with them, this GES, Gorilla Eye Service Recon mission, about providing additional access when this group was not available in the community each month. And we started this program where we worked with local foundations to install cameras, these retinal imaging cameras that are in facilities around Pittsburgh, which generate over 7,000 patient images annually. So these cameras are placed in community health centers so that the people who work in those centers can use them to take an image that can be sent and read by the clinicians at the Eye Institute. So we were recently gifted by a wonderful organization, Brothers Foundation, with a mobile eye van. And this has all of the equipment to be able to do an eye test and everything within one unit. And now this is going to be used by Dr. Waxman and his team, and they're going to be going in areas where they otherwise don't service currently with Gorilla Eye service. And then Hear Up is another program, again, where we do hearing education and resources for the underserved population. And it's founded by Dr. Catherine Palmer. It's essentially mobile clinics operated by the audiology department to provide free hearing screenings and care to the underserved populations in Pittsburgh. And they rotate monthly between the Birmingham Free Clinic, the Squirrel Hill Health Care Center, and Catholic Charities. And there's been weekend pop-up clinics that have been added. So a few years ago, from a conversation that started actually with one of the major benefactors to the Mission Mercy, Mr. Michael Zamias, Dr. Sahel and I started a conversation about having vision care as part of the Mission of Mercy. And then the following year, we had expanded that conversation to be adding hearing care to the Mission of Mercy. The Mission of Mercy is an annual 2-day free clinic that has always covered dental care. When we started joining a couple of years ago, then provided vision care last year, hearing care. Mr. Young will go over all this. And in 2022, we had 12 vision screening stations, 2 adolescent vision screening vans, in participation with Vision to Learn, and 8 hearing test stations and 2 otology stations. So the Eye Near Foundation participated possibly. Participation was possible because of our philanthropic support. We were able to donate eyeglasses, like 700 pair of eyeglasses, hearing aids, at a we received the hearing aids at a deeply discounted rate, but we were able to provide them free of care to the participants because of donations. As you see, much of it from our board of directors from the foundation, and also from the Jack Buncher Foundation. So without further ado, I'm going to turn it over to Mr. Young. Keith Young, as I mentioned, chairman of the Call to Care Mission of Mercy. Keith, welcome, and thank you so much for coming. We don't get too many guests to our program, so we're privileged to have you, and thank you for joining us.
Oh, I really thank you. I'm glad to be here. Love to talk about Mission Mercy. It's one of my favorite things to do. I'm also you called me Mr. Young a few times. I'm looking around for my dad. So he's not here. It's just me. It's Keith. So it is an honor to have worked with Eye and Ear and to integrate both hearing and eye care into Mission of Mercy. And I think we've had a pretty wonderful working relationship between you and Craig and Catherine and Jake. So I think it's been wonderful. But what I'd like to do for the folks in the audience is to just real quick give you a high-level overview of what Mission of Mercy is, and then go into a video that I think that will give you an idea of the scope and what happens at Mission of Mercy, because we've been in operation since 2017. And we, as as Lonnie said, we started with dental, and then for 2 years now we've had eye, and then we've had hearing care for 1 year. So it's expanded, and it's expanded not only with the services that we provide, but also in the size of where we go. We started out in the Palumbo Center over on Duquesne University, and then we moved to PPG Paints Arena where the Penguins play. And even with that, we didn't have enough space. So we have now moved to the convention center, and this will be our 3rd year in the convention center this year as we go. But I want you to see the video, because in picture in your mind, we've got 100 dental chairs in this huge space. You've got hundreds of patients, hundreds of volunteers that are wandering around doing all the work that happens. You've got 12 eye lanes. You've probably got 12 hearing stations. In fact, they're on the 3rd floor compared to where we have everybody else on the bottom floor. So I just wanted you to watch the video for that understanding of the scope, but also the impact that it has on the patients. So if you don't mind playing that, Craig, we'll start with that, and then I'll come back in. Mission of Mercy has expanded over the years, and we are now doing not only dental care, but also hearing care and eye care.
Personally, it's the greatest thing I've ever done in my life to see the miracle of healing manifested in the convention center of Pittsburgh.
I think it's the patients that we help, that they walk out with a beautiful smile and they appreciate what we do for them, and it makes them feel good about themselves.
Pittsburghers embrace this mission because Pittsburgh has a huge heart. When a community comes together, it is stronger together.
This actually means like the world to me. I have a hard time sometimes getting into my regular dentist.
I really didn't come to be a patient, but finding out I had a chance to be a patient, I thought it was great.
You look around and see there's a lot of volunteers here, but there's a lot of needy people here also.
This now is becoming part of the fabric of Pittsburgh. These folks are coming together because they know their neighbors right in their backyard need this care.
It really creates a snowball effect. Not only do we help fix their teeth, their eyes, and their ears, but we fix their spirit. And that spirit continues to thrive and flourish within the community.
It's really important for this event to keep growing because so many people are in need. They have done a great job of advertising beyond Allegheny County. So people come as far as Washington County and Greene County and Butler County, and to grow it to meet the demand and the need that we have is important.
There's an army of people that are making this all work. It's a passion and a caring commitment that everybody involved is making that just makes it work.
Everyone deserves the dignity of healthcare and being able to have the opportunity to live their best and healthy life.
We deeply appreciate the generosity of the clinicians that share their skill set. The community at large is so incredibly motivated to do good. It's a powerful experience to walk in and be surrounded by so many kind human beings in one spot.
What brought me here is a couple of friends who told me about Mission of Mercy. It shows Pittsburgh goes far and above to reach out to the community, to give a hand to people that could use it.
Well, I went for dental here. They pulled the whole top. My top teeth needed out immediately.
I was coming in to find out about the cap that I have on my tooth. Then I found out when I was here that you guys do vision, and I haven't had my eyes done in years.
It's really nice to be able to get dental work done and not have to worry about how you're going to buy groceries or make your car payment.
This event really epitomizes the spirit of Pittsburgh in that it demonstrates that the people of the city of Pittsburgh really care about their neighbors in need.
We had a patient in the chair today who said, "I'm not afraid of the dentist now." Somehow this environment makes it less scary.
Really great experience. You really come away feeling like you've helped some people who otherwise would be in far worse shape if they didn't get here today.
The most rewarding things for me is seeing the gratitude on the patient's face when you tell them that these glasses that they're getting today are for free. Just seeing the smile on their face and them saying, "Wow, I have always needed glasses I could never see before."
It's an interesting interaction of the emotion that takes place, of people that care. And you can see it in those who are here to be taken care of. And so it's kind of a bond that's very special.
The emotions I've been feeling have been pride. I'm so happy that we've been able to help all these people, and the patients I've seen, they're so excited when we tell them we have hearing aids here that we can fit them with if we find out they have that hearing loss.
To be able to fit people and get them hearing well has this huge impact actually, on their well-being. And we were able to do that today to people who simply don't have access to that care.
I witnessed it in an elevator. The person was just crying because they said they don't remember the last time they heard what they were hearing just at those moments when they were riding the elevator.
It's true that many people here will go away knowing that they've been treated with respect and care. My suspicion is that those of us who are here to serve them are going to walk away even more blessed because of them. The good that's being done here invites all of us, whether we're in a group like this one or in our individual lives, to reach out to people and do it from our hearts.
99% of the people in the world are wonderful people, and they just sometimes need a little help that they can't do themselves. And since Pittsburgh is this very special place, we do it better than anybody.
This is a life-changing event, and not just for patients, also for volunteers. Walking around here and see this mini hospital built in a day and a half that is fully functioning for 2 full entire days, it's impressive.
As both an educator and a clinician, it was astounding that we were able to bring so many clinical experts to this event. They have given their time and their talent, and especially their hearts.
Actually seeing the compassion of the volunteers, the compassion of the clinicians, and the gratitude of the patients. It's an amazing thing when you see that come together. That, to me, is the power of what's happening here at Mission of Mercy Pittsburgh. Thank you for watching that. I hope it gives you a little bit of an understanding of what this event does. I think you've heard it in the video, but this really has become a community event in Pittsburgh. It's the scope of it is large. We now have eye and ear working with. We have several hospitals working with us. We have volunteers all over the place that come in every year, and the number of patients. And that's really what I want to share with you a little bit. Just, it was in the video, but it was quick. The scope of this, we have since 2017, served over 5,500 patients overall. And in 2022, which was in the August event, we did 1,465 patients. And that's a lot of folks in 2 days, not only to do dental care, but to get them through eye and hearing exams too. So there's a lot of folks there. We had 1,155 volunteers, and you can see, I'm not going to read all those, the number of people that had that received dental, eye, and hearing exams. But the 681 is a big number. These are patients receiving free eyeglasses again, and the same with receiving free hearing aids. I think you have to keep in mind that these folks that are coming to our patients are the underserved. There are folks that are homeless. They are folks that have homes but don't have jobs. They don't have insurance. They may have insurance, but their copays are too high. And to be able to have these folks come in and be able to get eyeglasses and hearing aids and dental procedures is really important, because for some of these folks, it's a question of, do I pay the mortgage? Do I get food for this week, or do I get my eye care done, or my hearing or dental care done? So that's really a powerful part of what we do. And just on the hearing aids alone, the 229 hearing aids, those are $1,400 a pop right now. So there's a lot of folks can't even remotely come to affording something like that. And so that's why you heard from a couple of those folks in there. We had so many patients that said they hadn't heard for like 20, 30 years. So it's a very powerful impact on individual people, of course, but also on the community. And again, when you talk about community impact, and you can bring together a lot of people in 3 days. Actually, the first day is set up, the second day and third day are clinic days. But you can see here the value of dental care. And again, to me, the impactful number is the per patient value. These folks got over $1,000 worth of dental help. Same thing with eye care, 232, hearing care, the hearing aids I've already mentioned. This is money that a lot of these folks literally cannot afford. And when that happens, I think Lonnie said at the beginning, there's a disparity between, people getting the care that they need in the community. This is a perfect example. These folks would have a very difficult time affording all of this. And that's why we feel this is such a powerful mission here in Pittsburgh. And as you can see, the total value is close to $1.6 million that we were able to deliver through dental, eye, and hearing care. Next slide. I think that might be it on slides, but oh no, sorry. The other thing, and this actually, I'm glad I didn't forget this one, because you can see here the results of volunteers and patients wanting to return happy with the care. They're great numbers. It's what they are. But the thing that I want to point out probably most is that what we train all of our volunteers on and really hit home with them always, that we will treat people with dignity and respect that come in here. And that really has worked well. And I think that the patients feel that. They feel special. And a lot of these folks, you got to remember, are not people that get a lot of dignity and respect every day. And when they come in for that one day, they're going to feel like they're special. And we're going to help them as much as we can. And I think that's why you see that reflected in these numbers. That's critical, that we do that with that and treat people with compassion. And I think the number one, we also have feedback that we get on a survey, but the number one thing that comes back is the gratitude of the patients. The patients are just so thankful for what they have received. So I think that was it on the slides. I think there's a few pictures there, but I did want to let you know that, what we do, when we talk about dental care, it's not just coming in for cleanings or fillings. We do root canals, we do cleanings, of course, we do fillings, we do extractions, we do a lot of business in the extraction world. Folks, this is serious dental work. Last year, a guy came in, 26 teeth pulled. The one guy that you saw that was in the video, he literally would have probably died if he didn't have the teeth come out, because I think a lot of you know that the dental, if you have dental problems, that causes heart problems and some other problems for folks. So really, and we also actually have on site a lab where we actually do partial dentures. And then we do the eye exams, of course, and free glasses, and then the hearing aids and that. So I didn't know the scope of the need in Pittsburgh. In fact, 80% of our folks that come to Mission of Mercy come from within 20 minutes of downtown Pittsburgh. So folks, this is our backyard. It's where we live. And I didn't realize how much of a need there was, but this to me is a staggering number. 71% of the folks that visited us for dental care had dental pain. And almost 14% of those folks had dental pain for 6 months or longer. Now, I don't know about you, but if I got dental pain, I'm going to the dentist tomorrow morning. So these people are struggling with that pain. And what do they do to solve that pain? One, they self-medicate, or they go to the emergency room. And I don't think a lot of people understand the impact that, not having dental care done is to the emergency room. In fact, I got a statistic here, which I wanted to share from our folks. We ask how many people have gone to the emergency room for dental help. And again, remember, you go to the emergency room, you aren't solving the problem. But 54% of our folks told us they went to the to the emergency room. And there was over 35% of them actually had gone more than 3 times. So think about the impact, not only on them individually, but emergency rooms aren't there and they're crowded as is already. So you're backing up docs and nurses because of this impact from dental care. So when you're talking about what we do, it's also hopefully helping hospitals and with their emergency room care. So I think that's really an important feature that we do. I know we had some statistics. There's like 93 million people are at high risk for vision loss, and a lot of them never get to an eye doctor. In fact, I don't have a statistic on it, but there's a lot of refractive errors that never go detected, and that's because of lack of care, because of cost, whatever. But they're not getting to the care that they need. This is another staggering number for me. Only 18% of the people that need hearing aids have them. That's amazing to me. So the more we can do with hearing aids and getting them out, the better. And it's and only 24% actually go and have hearing tests. So there's some really big numbers out there that say this type of event, that again is a community event. This is not government, it's not anything. It's us coming together as a community to help with these kind of numbers and make that happen. So it's a really powerful event. One other thing mentioned before I get to the end here is a couple things actually is we also try to get people to aftercare, because again, these folks are getting treated once a year basically, but we also have Catholic Charities and Pitt Dental School that we send people to have aftercare dental work done. And we also, through Lonnie and his team, also set up, and Jake and his team set up appointments for people to do more serious type of eye work and hearing care. So that's, we need to drive people to doing more than once a year. We do it once a year, which is great, but we need them to do it more than once a year. So, and how does all this come together? Well, I mentioned before, to me, this is the ultimate in a community event, because how this is all funded is through mostly large corporations in Pittsburgh, some small ones, but mostly large corporations. The PNCs, the UPMCs, the Highmarks, the Highmark Whole Cares, Mylan. There's just a bunch of folks, the Mellon Foundation. So there's a bunch of companies coming together and foundations that say, we need to help with this, and they provide the financial support that we need. And I would be remiss if I didn't point out that the Eye and Ear Board actually donated $83,000 to this last year. So they walk the talk, guys. Think about that. That's their board. That came out of their own pockets, all right? So I think that's a big deal when you look at this, but that's how we fund this. Plus, we also have significant in-kind donations. Actually, in-kind donations are almost $600,000 that we get. So that's supplies, that's taking away the medical waste that we have. There's a variety of things, food, all kinds of things. So, and the last thing I'll close on, and this is my plug, it's shameless for sure. I want you to volunteer. I want you to come down. I'm going to tell you right now, and Lonnie, maybe at the end you can talk about your experience, because you can't imagine what I'm talking about until you walk into that room and see what happens. It's very difficult to comprehend, even off the video, but to see all these people coming together, 100 dental chairs, all these folks working together, making it happen. And I will tell you this, and you can, if you see me and you tell me that I was wrong, let me know. This will be one of the best volunteer experiences you do. It's very tangible. It's not, and I don't mean anything bad about this, but it's not like running a 5K for Heart Walk. You don't see the outcome. You're going to see the patients. You're going to walk patients through. You're going to see the gauze in their mouth. You're going to hear the people say, I haven't heard for 30 years. That is what's going to make this a profoundly moving volunteer event. This is a very different kind of volunteer event that I think you would get a tremendous amount out. So please volunteer. We need probably this year, it's probably going to be a little bigger, probably need 1,200 volunteers. And we need more general volunteers than we do clinical volunteers. So please sign up. Sign up will start probably about mid-July. And the way you go to that, and I think Lonnie can probably send out a link just so that people know, but our website is mompgh.org, pretty simple, mompgh.org. That's where you sign up. You can see that video on there. Again, a bunch of other stuff and things that we've been in the news with. But it really is a powerful 3 days, including setup. Setup's kind of a pain, but they're still powerful days for that. So would love any questions if we can, or Lonnie, if you'd like to comment. Those are pretty much my comments.
Well, Keith, Thank you so much. I absolutely 100% can confirm your enthusiasm in terms of volunteering. It really is incredibly rewarding. And one of the most surprising things to me when we started getting involved with Mission of Mercy is just to see the sheer numbers, but also as people are coming in, they're coming in a stage where most of us don't understand how we take these things for granted. When I have a toothache, I call my dentist, very quickly. When I have an issue that I'm worried about with my vision or hearing, I have ways to take care of that. And I can assure you that everybody coming in was in a situation where they were at a point where they really were looking for some help. And large numbers, as you saw, people who come in, and quite an amazing operation. One thing I'll add is that we are looking at the 3 service areas that for people who, have insurance, these are the areas that are more likely to be not part of your plan, or there's a higher number of people without insurance for dental care, for vision care, and for hearing care. And the other thing that does happen there is for people who are coming in that are trying to find out how they can get on insurance for their care. Oftentimes, that's part of the problem. There's volunteer and help provided for people to learn how they can get hooked on to the federal program or the state programs that would be able to provide them support. So it's really just a great experience. I highly encourage you volunteering, and obviously we're looking forward to participating again this year and in the future. So I do have some questions, but Keith, before I get to those, so this has been going on for 7 years. How did this get, what was the tipping point to get this started? Just who got together and how everybody decided to do this? Because that was before our involvement.
Yeah, this was back in 2016, before we even started. There's another group called Ma and Pa, which is a dental clinic like ours that travels around Pennsylvania. And they came to Pittsburgh in 2016. And they didn't run it as well as we do, but that was one problem. But the second was they weren't coming back to Pittsburgh for 5 years. And so Dr. Dan Patouche, who's a maxillofacial surgeon at UPMC, said, we have to have this care annually for everybody. So he went to his buddy, Michael Zamias, who he owns Teletracking, founded Zamias Properties. And he asked him about this. And so Michael donated the initial tranche of money to make this happen. And I worked for Michael at that time, and he came and said, I need somebody to run this. So that's how I got involved, and I got a bunch of volunteers involved, and we've grown it every year. Now, we didn't do 2020, of course, because of the pandemic year, which was absolutely a shame, but that's okay. But that's how it got started, and now it's just grown every year. And as we said, in 2021, we started with eye, and 2022 with hearing, and it's just grown into this, what I think is a community event that has a lot of impact in our Pittsburgh area.
Well, the first question actually is the same thing that you were plugging here at the end, is how do I volunteer? So let's just repeat it again.
I love that. Whoever that is, thank you. It'll be a sign up online, mompgh.org. And that sign up will not be until around July. Lonnie, you have emails of all these people, right?
We will.
We will make sure we send everybody that participated in this an email that will tell you when sign up starts. And all you do is go in and you pick what shift you want. We run shifts. There's 2 shifts a day. There's a setup day, and that's a little bit different. We need people then, but you're not going to see the impact of the patients on setup day. The clinic days, there's 2 shifts. One starts, you got to get up early. It starts at 5:30 and ends at 11:30. And then the next shift is 11:30 to 4:30. So you can come in and you can sign up. As I said before, we had 150 dentists last year, which is, I'd love to have 170. So we need more dentists because we can get more done with that. But the vast majority of people are general volunteers. And one other plug, one of the positions we have is called patient ambassador. And if you get in to sign up early enough, because people love this role, and there's a lot of them, it's walking with the patients through their day, and it's taking them where they need to go and helping them. And I'm going to guarantee you're going to get their story. And we get so many of those stories, but people love doing patient ambassador, and they get to really personally walk and work with these people. So I really hope you do sign up. I think it'd be wonderful.
If you're a patient ambassador, you also get your exercise in for the day, for sure.
Amen.
The convention center is very big. So what surprised you the most about the 2022 event?
One, I think the need for hearing care. I don't think I'm not on that hearing side of the world, but when we first started talking with Catherine Palmer, we thought, okay, we'll give out a handful of hearing aids or whatever. We ended up giving up 229 hearing aids. In fact, we had to buy more in the middle of the event.
Yes.
Because there were so many. We didn't realize the impact that this was going to have, I think, from the hearing standpoint. But also the other one, and we really push veterans, and we want vets to come. I mean, there's a soft spot in my heart for veterans, no doubt. They've done wonderful things to keep us free. And so we actually expedite them through, and we've been trying to get more and more vets there. Last year, we were able to do that. I think for those of you who are Pittsburghers, you saw Rocky Blyer. He's a vet, and he was an ex-Steeler, and he is our ambassador to get vets there. And that, I think, was a really powerful thing to have people there too. So, and maybe one other thing. I don't know if you saw Bishop Zubik. I was amazed at the guy. He wanted to come. He actually volunteered, which was great. But I thought I'd just come in. The number of people that flocked to him and Rocky Blyer was amazing. I mean, they were like magnets. That was, to me, like, I couldn't believe how that was. And Rocky's just a tremendous guy to chat with and talk with. But the people just kept drawing to them. It was pretty amazing. So to have those kind of dignitaries at the event really was really a pleasant surprise, if you will.
Well, you're right about, I would say the same thing as far as what surprised me, because on last year's event, because we really did underestimate the number of hearing aids, and Catherine did actually have to order more that night, which we were fortunately able to do. But also from one of the volunteers, my wife, who's a volunteer audiologist, the number of people who came almost to a person had significant hearing loss. So again, it's not something you see when you generally screen people for hearing loss, is that high of a percentage that had significant hearing loss. So again, as I said, I think they're coming at a point where the need was very significant. So how common is it to have health insurance but not have dental, vision, and hearing benefits?
Well, I don't know the answers specifically to that, but I can give you the data from the people that show up at our event. 70% who come have no insurance. So there's 30% that do. And in talking with them, so this is anecdotal, but in talking with those people, a lot of them don't have dental coverage have dental coverage, but have huge copays. Again, same discussion I had before. If I've got $1,000 copay and I've got to figure out whether I go to the dentist or not, or I put food on the table, it doesn't matter if I have insurance. The copay is going to kill me. So again, I don't know the statistics out there, but there are a lot of plans that don't. I know the VA, they have some dental coverage, but it's not enough. That's why we push the vets to come. And I also want to say that unless you get a supplemental plan with Medicare, you do not have dental coverage. So those are the couple that I know.
Right, and it is a challenge. Medicare does not cover, as many people know, does not cover the cost of hearing aids. Neither does Medicaid. It does for children, though, up to the age of 18. So through the CHIP program. So there's just a tremendous amount of gaps, and obviously hearing aids are expensive even for those who for all of us, and certainly out of reach for many. All right, so do you have plans to expand the mission to occur more than once a year?
Not more than once a year. We are looking, I'll explain that in a minute, but we We are looking at expanding outside of the Pittsburgh area if possible. And there's discussions about that, and we're working a strategy hopefully around that, because we know that West Virginia has similar type issues, Maryland. So there is discussion of doing that. Believe me, that will take a lot of work to do, but why we don't do it more than once, my main reason is volunteer fatigue. We would have a very difficult time getting dentists, which we have a push anyhow to get them to do this twice a year. They're very busy. They have their own practices, and they give up revenue every time they come to help because they're not seeing their patients. Same with hygienists. So I think that would be a difficult thing, but it would also be tough because a lot of people said, well, we'll divide it up. We have 1,400 patients, you do 700. It's not going to work out. The math isn't going to work that way. They see the first one and the 1,400 people are going to show up. And then the next one, the 1,400 people are going to show up again. So it's one of those logistical things that I think would be very difficult to do more than once a year.
So this question, we discussed it a little bit, but maybe a little more detail about the follow-up care. So between missions, what are people doing to try to get the care that they need?
Yeah, and that's really a good question to ask too, because it's one that's broader than Mission of Mercy. And we have Catholic Charities, they're called operatories. That's basically a chair with it. They have about 6 or 7 of those, and we send a considerable number of those people there. And Pitt Dental School also has the capability to do that. The Neighborhood Resilience Project only has 1 operatory, but it's a place to go. It's in the Hill District, so we can send people there. So we do send people to those places. I'll be honest with you, we go out of our way to actually schedule times with them, and a lot of people don't show up. Now, I'm not casting aspersions. Some of them can't get the ride, they do whatever, but they just don't come. And so last year we were able to treat about, and again, I can talk dental, we saw 965 patients. Not every one of them needed aftercare, but probably 2/3 did. And we got about 100 that actually showed up for aftercare. That number needs to be 4 times that. But we constantly push that. In fact, we make people go over to Catholic Charities, literally. If the doc says you need aftercare, we walk you over to Catholic Charities and say, talk to these people. Because it's a great question, because that's an ongoing issue, and you need to have that care more. And it's the same with eye and hearing care. You need that more than once a year.
This absolutely. And yes, we have the same sort of problem in that we lack of follow-up care, but that's a problem in all of our clinics and it is part of the issues around social determinants of health barriers that we're also working on and other strategies to try to address those outside of these types of events. Do other cities do events like this and at this scale?
They do. There's about 30 Mission of Mercies across the country. What makes Pittsburgh unique, and we are the only one, although Arizona might do it, but we are the only one that does it in the same city every year. And that's what makes us unique. They have that traveling roadshow type of thing, and they move around. Or, in fact, when I say 30, they'll skip a year, which I'll be honest with you, I don't get that. It just makes the dental problems and the hearing problem, and actually, I'll go that. It just makes the dental problems worse if you're skipping a year. So like, I know Minneapolis does one. They only do it every 2 years. I don't get that, but yeah, they have their reasons. But the other thing that is different for us, of course, is we do hearing and eye care. That makes us different than these other missions. And so Pittsburgh is unique in that we do it same city every year, and we have hearing and eye care.
So how do you spread the word to groups that might not have access to the internet or TV? As you mentioned, those are some of your media.
Yeah, what's interesting about, I'm going to give you a statistic first, which I have them here. I want to pull it up. I always thought that everybody, or a lot of people, again, would find social media or stuff like that. But we asked, how did you find out about the clinic? 62% said TV or radio. That's old school, right? But 62%, that's how they find out about it. And 25% said they found out from a family or friend. Social media, they found out 3%. That was it. So it's interesting that TV and radio still is a big thing. Now, for the homeless people, though, that is different, and we do grassroots marketing. We literally go down. I used to work at or volunteer at the Red Door, which is done on Stanwyck and the Boulevard of the Allies, and that's where a lot of the homeless come. We go down there, talk to, like last year I went down and I talked to a bunch of them. We also give flyers out. We go to Light of Life. We go to the Jubilee Soup Kitchen. We go to churches, and we actually hand out flyers to get people there too. And since I know some of the Red Door people, I know they come because I worked with them. I can see them coming and they show up there. So that it's a very different kind of marketing approach for the folks that don't have a home.
So what goals do you have for any future events? Anything different?
As I mentioned previously, expanding to other areas, but I think we're getting close to capacity with this. I think we can do 1,550 patients maybe, but I think there's a capacity limit, one size, but also the number of dentists and clinicians on the hearing and ear side. So I'm hoping for this year, which by the way, the event is October 26th through the 28th at the convention center. And as Lonnie said, it's a lot of space. We have 90,000 square feet on the first floor, and then we've got probably another 15,000 square feet up on the third floor. So it takes up a lot of space. We are hoping, I really would like to see us exceed 1,500 patients this year as we go through this.
Well, that's an excellent goal. Is there anything different that we'll do in 2023 to see that happen, or any changes?
Yeah, well, it's going to be similar type of marketing, because we actually have a couple of companies that donate most of their time to us to help us market this, and they do a hell of a job. Mm-hmm. And I think it's now, to me, why I think that goal is achievable is we're just getting more and more people understanding that this is here. Every year, people understand more and more that Mission of Mercy is here.
Word of mouth is really powerful.
Absolutely.
So I'll answer this question because it's about the prescription glasses. So the question is, when you give somebody prescription for glasses, can they just take it anywhere? And it's not how it works actually, but so we're getting them donated from the Esler Foundation, which is wonderful. So they give them to us. We can give it to people for free. So what we do is we get the prescription done that day when they get their eye tested. And then we have a date scheduled, or a few dates scheduled, for people to come and get their glasses and pick them up at one of the Vision Institute facilities. If they can't do that, we get their address and we have it sent to them. And it's worked out fairly well. We are able to get the prescription glasses to almost everybody. And we offer through our optical shop, any of the UPMC optical shops, if there is a problem or repair or other things are needed, they can come in anytime. So we do everything we possibly can to help that follow-up service. Are there any particular stories you can share that stand out in your mind?
I do have one. This wasn't from this year's event. This was from the 2019 event when we had it at the PPG Paints Arena. And I get there very early, and you have to realize these people start lining up at midnight the night before. They sleep outside to get in. And so I get there early to go and talk to people and, all that kind of stuff. Other people do too. It's not just me, but I go there. And I'm talking to this one guy. He's like about 10th in line, and his mother-in-law is with him, and he's probably 30 years old. And we chat, and it's nice, and so it's fine. And so I happen to run into him after he's in the procedure area, and he just gets done with his extractions, and he's talking through gauze, and he said, "Yeah, I had 12 teeth pulled." And I said, "Oh, okay, that's tough, but okay." So he goes on his way with his mother-in-law, and then the next day I come in Saturday morning, and I'm walking the line, and I see this guy in line again. He said, "What are you doing here again?" He said, "I need another 14 teeth pulled." And they couldn't do them all at once for some reason. So and his mother-in-law was just saying, this was such a blessing, because he literally would have had significant physical issues. And he's like 30, 31 years old. This isn't, an older person. And he would have had significant that this was life-saving to him. His mother-in-law was just so he went in and had another 14 teeth pulled. So I think you see, it's pretty serious stuff.
It really, there are many stories, and I know one gentleman who was, because I mentioned you can get hearing aids for free up until you're 18 years old. He had hearing aids, and then, you know, after he turned 18, something happened, and he couldn't use his hearing aids anymore. He came to the event. He's 38 years old now, and we were able to provide him hearing, and he was so excited. First time he'd heard in that many years, and that one stands out in my mind for sure. But there were so many on all throughout the event. But again, you just can't, you know, put any amount of emphasis on how you know, shocking it is, I guess, to see the amount of need that's there, and the things we just generally, many of us just take for granted in terms of being able to provide basic, what I consider basic care with dental, vision, and hearing. So it's a pleasure to be involved with it. We're done with questions. I want to thank everybody for coming. And Keith, I want to thank you, and I'm going to say something about you. One of the great things about being involved with the Mission of Mercy, from my perspective, and really getting involved and helping in planning everything, it is working with you, Keith, because it makes it an environment I think we all enjoy, seeing each other and working with each other. And one thing for everybody to know, Mr. Young is a volunteer. So we all need to thank you for all the time that you put in, and we all appreciate it.
Well, that's very kind of you, Lonnie. And we do have, I think, a wonderful working relationship, and thank you for those kind words.
All right. Well, thank you, folks. Thank you for spending some time with us and learning about Mission of Mercy. And this is recorded again if you want to share it with any friends. And we'll look forward to seeing you again on our Sight and Sound Bites webinar series.